Hello all, welcome to Gynae Wizard channel. So today is regarded as the World Contraception Day, that is 26th of September every year. So everyone deserves an accurate and unbiased information about the access to contraception, which should be tailored according to the individual needs, and they have the right to reproductive agency. So this is a right of every woman to choose whether, when, and with whom to have a child without any caution, fear, and judgment. So that is why the theme of this year is regarded as a choice for all, agency, intention, and access. So, whenever we are advising on contraception or a woman seeks to you for contraceptive advice, we have to always use a cafeteria method. So, what is it? We will provide her with the information about various methods which are most suitable to her, and she will make the final decision based on her individual preference. And we follow something called as a gather approach. So, what do we mean by gather approach? Firstly, we have to greet in a culturable, acceptable way, and then we have to ask about the client and her needs, and then we have to tell the client about the family planning methods and the reproductive health services, and we have to help the client choose her method, and we have to explain how to use the method, and also we have to tell her when to return to follow up and when what are the adverse events when she has to come immediately for healthcare. Now, facility. So that is called as gather approach. So once we help her to understand the benefits and risks associated with that contraceptive method, it is her own decision to follow it or not. So this is about gather approach. So today in my snapshot number 5, we will be discussing in detail about oral contraceptive pills. So these oral contraceptive pills are again divided into combined hormonal contraceptive pills, which have both the component of estrogen and progesterone, and we have progesterone only pills, which are also called as mini pills. So firstly, we will understand the role of estrogen and the role of progesterone. So this estrogen, which was derived from a natural estrogen, and this was having a higher chances of risks like cardiovascular risk or venous thromboembolism risk, and the derivative of estrogen, that is mestranol, had increased VTE risk. So now we have come with the newer derivatives called ethinyl estradiol, which have a low VTE risk, and they also mimic the natural estrogen that is endogenously produced and also helps in contraceptive practice. So now ethinyl estradiol or estradiol valerate are the most common pills or the most common estrogen form which is present in the OC pills. And next, coming to the progesterone component. So in progesterones, we have the natural progesterone and synthetic progesterone. So we use synthetic progesterone in the occipits, which are also called as progestins. So these progestins can be classified based on their precursor molecule and based on different generations of progesterone. So how do we classify based on precursor molecules? So this synthetic progestin, so they have two forms. One is structurally related to progesterone, and the second one is structurally related to testosterone. And in this, we can again divide as pregnant derivatives and non-progesterone derivatives. So in pregnant derivatives, we have acetylated form and non-acetylated form. So in acetylated form, we have medroxyprogesterone acetate and megestrol acetate. In non-acetylated form, we have dihydrogesterone. And in non-progesterone derivative, we have demegestrone, nesterone, and normegestrel acetate. And in structurally related to testosterone, again we have something called as estranes and gonads, which are the ethynylated forms. And non-ethynylated are dinogest. So in estranes, we have norethindrone, norethindrone acetate and ethinydiol diacetate. And in gonads, we have levonorgestrel, disogestrel, gestodine and norgestimate. Now coming to the different generations of progesterone. So first generation, we have norethisterone, norethisterone acetate. Second generation, we have levonorgestrel. Third generation, we have disogestrel, gestodine, norgestimate. Whereas fourth generation, we have drosperinone, cyproterone acetate. So what is the importance of different generations? So as the generation advances, the progestational effect increases, whereas the androgenic effect, estrogenic effect and mineralocorticoid effect decreases. So that is why the fourth generation progesterone are the most potent form of progesterones. So with this background of estrogen and progesterone, we have both of these components in the oral contraceptive pills, that is combined hormonal contraception. So in these, what is the mechanism of action? So mainly this estrogen and progesterone has different effects on all the three parts of the reproductive system. That is, it has an effect on the ovary, it has effect on the uterus, the cervix and the tube. So what does it do? It mainly causes an ovulation. So it inhibits the ovulation to occur, and because of the progesterone, it has the anti-mitotic action. So that is why it causes thinning of the endometrium, which causes the implantation failure, and also the progesterone thickens the cervical mucus. So this prevents the sperms to penetrate into the uterus, and lastly it alters the tubal motility. So that is why it also prevents the fertilization to occur. So ovulation is prevented, fertilization might be prevented, the implantation might be prevented, and the ascent of the sperms also might be prevented. So all these mechanisms will contribute to the contraceptive efficacy of the oral combined pills, that is combination of estrogen and progesterone. So these pills are very important for us to know what are the types of pills which are available. So the types of pills which are available are based on the estrogenic and progesterone component throughout the cycle. So if throughout the cycle, if these components are of the same dose, then we call it as monophasic pills. So if the dosage of estrogen or progesterone varies at least once, if it varies, they are called as biphasic pills. If they are varying thrice, so there are three different pills with three different dosages. These are called as triphasic pills. And there is something called as multiphasic pills where there is alteration of both estrogen and progesterone component in the cycle. So what is the main motto of these biphasic, triphasic and multiphasic pills? It is mainly to decrease the dosage of estrogen and progesterone. So in turn, we are decreasing the cumulative amount of estrogen and progesterone which is taken by the woman, and in turn we are decreasing the side effects and adverse events of the same. So usually in the biphasic and triphasic, the estrogen amount remains the same, whereas the progesterone dosage will vary. But in multiphasic, or also called as four-phasic pills, the dosage of both estrogen and progesterone will vary. So based on these principles, we have different brands of OC pills which are available. So always postgraduates have a confusion which pill to prescribe, which is best for the woman. So remember two important points. So you have to ask her whether she has any unscheduled bleeding or breakthrough bleeding in her cycles. So if these breakthrough bleedings are present, so then it is always better to have a stable dose of estrogen in her cycle. And the second one, you have to also ask whether she is having any side effects because of OC pills. So if she has any side effects, then decrease the dose is very important, and triphasic pills are mostly preferable. So this is how you individually categorize the woman and then determine which pill is best suited for which woman. And then we also have different types of regimens in which these OC pills are given. So there is something called as normal regimen of 21 by 7. So that means there is 21 days of hormonal pills which are given and 7 days of hormonal free interval. So this is a very important take home point which you have to remember. So all we have the government supplies, that is Mala N and Mala D. So these Mala N and Mala D, they have 21 hormonal pills. So they contain ethinyl estradiol 30 microgram with levonorgestrel of 0.15 mg of 21 pills, and they have 7 pills of ferrous fumarate. So this is a combination where they have 21 hormone pills and 7 non-hormonal pills or placebos which is given, and in this hormone free interval she will get her withdrawal bleeding. So this is mainly given in order to regularize the cycles. But there is something called as an extended regimen. So what do we mean by extended regimen? We can extend the hormone pills to 24 and we can shorten the hormonal free interval. So this establishes the decreased side effects of hormone withdrawal, and also it decreases the breakthrough bleeding. And there are certain conditions where we have to provide OC pills for the end cycle or for a long period of time. So this regimen is called as a continuous regimen. So there we give 8 pills continuously and then wait for withdrawal and again start with 84 pills. So there are different brands like Seasonal, Seasonic, all these are available in the market. So where use these continuous pills? Where we want the anovulatory effect or we want this anti-estrogenic effect for us for different gynecological conditions like endometriosis, fibroid, adenomyosis, or whenever she has dysmenorrhea, PMS, all these, whenever you want to prevent and you want to give ossiples for the same, so you have to ensure that there are at least 4 withdrawal bleeds per year, and that is why we give a hormone continuously for 84 days and then we wait for withdrawal and again we start the next cycle. So this is called as a continuous regimen. So this is a snapshot of different types of pills, that is monophasic, biphasic and triphasic and four-phasic pills. And I already mentioned that the monophasic pills contain the same dose of progesterone and estrogen throughout the cycle. And these are the different brands which are available, namely Overall L, Overall G, Intimacy plus 2, 3 and Diane or Crimson 35 with the dosage of estrogen and progesterone and the indication for all this. And we also know the famous Mala N and Mala D. These are government supplies, and Mala N is available freely from the government. So you can remember government has N in it. So that is why this Mala N is free of cost, and it contains ethinyl estradiol 30 microgram with levonorgestrel 0.15 milligram. And Mala N is available at subsidized rates by the government, and this also contains the uh, same combination of estrogen and progesterone. And the biphasic pills, we have some brands called Orthonovum or B Novum. So they clearly mention for the first 10 days and the next 11 days that there is change in the dosage of progesterone. So in the first 10 days, the progesterone, that is norethindrone, is 500 microgram, whereas the next 11 days it is 1000 microgram. And next, coming to the triphasic pill, that is the cyclisa, with the same amount of estrogen which is given throughout the cycle, and we can observe clearly that the progesterone dosage is increasing from the first week to the second week to the last week. So the dosage of progesterone goes from lower dose to higher dose, mimicking the natural cycle. And the last table shows you the multiphasic, that is the four-phasic pill, which is also called as Clara. And there are four different phases: the first 2 days, 3 to 7 days, 8 to 24 days, and last 25 to 26 days. And the amount of estrogen valerate is going on changing, and also the dynogest is also changing in the cycle. So this is a four-phasic pill, and the best example is the Clara, which is the available in the market. So this slide shows you the different forms or different basic pills of OC pills. So whereas overall G contains the norgestrel, that is the second generation progesterone along with ethinyl estradiol, whereas Yasmin and Yas contain drosperinone, that is the fourth generation progesterone with a higher efficacy and lower side effects. Whereas Nikon is the biphasic pill, Triquilar is the triphasic pill, and Clara is the four-phasic pill. So now we have to understand what is the failure rate which is depicted by the Pearl index. So what do we mean by Pearl index? So the failure rate of the women who use a contraceptive method for 1 year in 100 women. So with respect to OC pills, the Pearl index is around 0.3 to 0.5 per 100 woman year if it is an ideal use, and around 8 per 100 woman year if it is a typical use. And also, apart from contraception, we should also know the non-contraceptive benefits of OC pills. So this is a very important 10 marker, and also it is important for your day-to-day clinical practice. So what are they? Firstly, the cycle regularization in cases of PCOS and other conditions where there is an irregular cycle and you want to regularize it, and some of the menstrual disorders. So whenever there is any abnormal uterine bleeding, premenstrual syndrome, dysmenorrhea, functional ovarian cysts. So all these conditions we can use oral contraceptive pills, and also these are very beneficial to decrease the CA risk. So what CA? Endometrial CA. The risk of endometrial CA decreases by about 50% if they use for 1 year, and this benefit will be persistent for about 20 years. And also the risk of ovarian cancer decreases by 50% if they use at least for 6 months, and decreases by 80 to 85% if they have used at least for 5 to 10 years, and this the benefit persists for about 10 years. And they also decrease the risk of colorectal cancer. So this risk is decreased by 18%. So mainly it decreases the risk of ovarian cancer because it prevents incessant ovulation, because OC pills, as already mentioned before, cause an ovulation. And these also are protective against benign tumors like fibroid and fibromyomas, and they are also protective against benign breast disease, and they also decrease fibromyoma. They decrease the size of the fibromyoma by 30%. Also, it helps in decreasing in PID because it prevents the ascent of sperms and these bacterial infections. The ascending infection is prevented and it decreases the PID by 50%. It decreases the ectopic by 50%. And also it is protective against rheumatoid arthritis and osteoporosis. And also, it is very important in the treatment of various conditions like endometriosis, fibroids, and all other estrogen dependent gynecological conditions. So, these are a very long list of non contraceptive benefits of oral contraceptive pills. Now coming to the what are the minor side effects and what are the major side effects of OC pills. So what are the minor side effects? There might be some amount of vomiting, GI discomfort, and they might have nausea, they might have headache, and they might have breakthrough bleeding. So what is breakthrough bleeding? So whenever the amount of estrogen is reduced in the serum, there might be some amount of bleeding in intermenstrually. So this is called as breakthrough bleeding. And some women have some mood disturbances, heaviness in the breast or abdominal discomfort, or they might have some mood swings, and some women have weight gain, acne, and some women also complains of leg pain. But all these are minor side effects. But what are we concerned majorly is the major side effects. So OC pills have a higher risk of venous thromboembolism, breast cancer, cardiovascular disease, cerebrovascular disease, that is stroke, and also it increases the risk of liver disorders, especially hepatitis, gallstones, and also it is important that these have an increased risk of CA cervix. So the risk of CA cervix is around fourfold increase if it is used for more than 10 years. So routine pap smear screening is required, and also it increases the chance of breast cancer also. So that is why screening of breast cancer is also important, and progestogen is the main culprit for its risk in breast cancer. So all these are the major side effects. So those who have a family history or a personal history of venous thromboembolism or breast cancer, or if they have other risk factors like if their age is more than 35, BMI is more than 35, if they have previous history of all these conditions, or if they have smoking risk, or if they have dyslipidemia, always we have to avoid OC pills. So that's when we have to understand what is called as a medical eligibility criteria for oral contraceptive pills. So we all know that each contraceptive method has four categories of medical eligibility criteria. So what is category 1, category 2, category 3 and category 4? So category 4 are absolute contraindications, and category 3 is risks overweigh the benefits. The category 2 is benefits overweigh the risks, and category 1 is completely safe. So what are the category 1 of the oral contraceptive pills? So mainly it can be started after 6 months after delivery, and it can also be started post abortion, post ectopic. Nulliparous women can easily take, and if they have a minor risk of any other comorbidities which are treated and they are in a euglycemic state, normotensive. So all these women have a safety of taking OC pills. And also post molar, for the surveillance of beta HCG, it is always preferable to give OC pills for a period of 6 months till her beta HCG follow-up is completely done. And what is the category 2? Where the benefits overweigh the risks. So if the age of the woman is less than 35, if she has a history of hypertension but it is under control, if there is uncomplicated cardiovascular disease, or if it is between after 3 months of delivery, all these are category 2. What are category 3? The age of the woman is more than 35, if she is smoking less than 35 cigarettes per day, if her breastfeeding, she's breastfeeding woman, but more than 6 weeks, but less than 6 months. And if she's a case of hypertension, but not under control, and if she's a case of hyperlipidemia. But what are the absolute contraindications? If she has history of breast cancer, if she is more than 35, if she's smoking more than 35 cigarettes per day, and if she's less than 6 weeks postpartum, if she has multiple comorbidities like hypertension, diabetes, dyslipidemia, and if she has any active hepatic disease, gallbladder disease, and if she has any major risks of venous thromboembolism or cerebrovascular complications like stroke, all these are absolute contraindications of usage of OC pills. So all these we have to keep in mind when advising OC pills. So when it can be safely started, so it can be started from day 2 to day 5 of cycle. If she's in the interval phase or after delivery, it is always preferable to start OC pills after 6 months of delivery. So by 6 months, everything would have come back to its previous risk, and the risk of VTE will be minimized. So that is why it is always better to start OC pills after 6 months. But if you are taking progesterone pills, it can be started after 4 weeks, that is after 1 month. So this is about when to start the OC pills. And how should we use? So we have to use continuously for the that particular regimen, either a normal regimen or an extended regimen or a continuous regimen. We have to advise the woman to take the OC pill in the same time of the day, and she has to not miss even one pill. So because the same time of the day is advocated, because the serum levels of estrogen and progesterone have to be maintained for giving a best contraceptive benefit. So this is the last part of today's discussion, that is missed pills, which is very important for us to understand that whenever a woman misses a pill, there might be decrease in the contraceptive efficacy of the oral contraceptive pill. So based on how many pills she has missed and what part of the cycle she has missed those pills. So if one pill has been missed, that is okay. She can take the pill immediately when she remembers, and she can resume her schedule, and backup method is not necessary. But if two pills are missed, and that too if it is missed in the first week or second week, she can take two pills for 2 consecutive days, and then she can finish the pack. And it is backup method can be a backup method is usually not required, but it can be advised for 7 days. So she can have a sexual abstinence for 7 days, or use a barrier method or any other method of contraception, that is called as a backup method. But if she misses these two pills in the last week, that is the third week of her intake, that time you have two things which you can do. Either you can do a day one start method or a Sunday start method. So if she misses two pills in the week 3, you can start a new pack and then use a backup method immediately for 7 days. Or you can continue daily one pill till the next Sunday, which is there, and on that Sunday you start a new pack and then you use the backup method immediately. And from the Sunday which you have started, you continue that pack till it gets over. So this is when she misses two pills. And what about when she misses three or more pills? So that time you don't advise her to take either 3 or 4 pills on the same day. Instead, we have to ask her to either start a new pack and use a backup for 7 days, or she can take daily one pill till the next Sunday, which is arriving. And from that Sunday, start a new pack, and she has to use a backup method for a week. So this is how you manage a case of missed pills. So that was about oral contraceptive pills, the amount of estrogen and progesterone which has to be taken, what is the mechanism of action, what are the types of pills, what are the different types of regimens, what are the non-contraceptive benefits, what are the side effects, what are the advantages, what are the adverse events, and what is the MEC criteria, and how do you go about when she misses a pill. So this all things are important when it comes to oral contraceptive pills. So why awareness is always better you create in your OPD, in your obstetric patients and all the gynec patients who come to you. Provide them awareness regarding their contraception, because always remember, prevention is better than cure. It is MTP or doing an abortion is not a method of contraception. So contraceptive methods are available and they're available for free in the government. So it is our duty and responsibility to emphasize this and create awareness amongst our patients. So with this message, I would like to conclude my session. So for more information and for more information regarding OBG topics, you can subscribe to my channel. And also there is a PG course available on Gynae Wizard. So if you have any other further queries, you can mail me on gynaewizard@gmail.com. Thank you.